Good morning, everybody. Yeah, I consider this as a privilege uh, and it's a pleasure to be with you for as part of this awareness program, which is being organized by CIA. As you know, that breast cancer is the most common cancer among the women worldwide, and it's not a new disease. Okay, it has been known as long as history has been recorded. I don't know whether you have read the book History by Herodotus. Herodotus, in his book, described Atelsa, that is wife of Darius, king of Persia, having breast cancer from which she died in 400 BC. So it's not a new disease, basically. So before going to breast cancer, we should know what is cancer. Here we know that the cancer cell normally divide and it is uncontrollable. That results in tumor. If these cells are normal, for example, suppose there is no mutation, such things, we call it as non-cancerous. When these cells are abnormal and when it functions abnormally, we call it as cancerous growth. And also cancer cell, you should know, remember, it can spread from the site of origin to other parts of the body. For example, it can go to lung, liver, bone, brain, etc. Yeah, this is see the pic. The you can see the normal cell division. You know the body, our body contains trillions of cells. All these cells arise from one single cell. To get trillions of cells, the cell should undergo cell division. All these cell divisions will be supervised by certain genes in our body. But during this process, sometimes the cell will get damaged also and it will be repaired also. But suppose there is no repair, there is a mechanism in the body to destroy these cells. We call it as cell suicide, but the jargon is apoptosis. But in tumor, when these controlling genes are not, if these genes are not doing its function normally, then the cell division will take place without any control. We call it as, the change is called a mutation or alteration in the DNA. The mutation will lead to further tumor cell growth, which is unwanted and unnecessary. That leads to tumor. Let us see what are the common cancers in women. According to the Globocare 2014, breast cancer is the most common cancer. But if you go to the rural areas, you can say that cervical cancer is more common than breast cancer. So, before going to the subject proper, we should know the importance of breast awareness. One should be familiar with one's normal breast and one should know the dynamics of the breast at different times of the month. It should become a part of caring of our body. So every woman should be breast aware. That is very, very important. Let us see what is the normal breast. It is composed of tissues, muscles and glands. You can see These are lobules or small sacs that will become lobes, major sacs. Consider this is a balloon, something like that. In this area, the milk is produced. So the milk should be drained through these, and it will be drained through these ducts, and it will reach the nipple. That is how we feed the child. Now the breast cancer originate in the breast tissue, mainly in these ducts. But it can arise in other parts of the sacs also, and also the tissue surrounding these sacs. But common site is these ducts. Also we should remember, if you don't treat properly or if you don't detect it properly, these cells, tumor cells, can travel like this, can go to the lymph nodes. These are glands in our armpit. We call it as metastasis. It can again travel through the blood vessels. It can go to lung, bone, liver, etc. Yeah, breast cancer in 2015, we diagnosed around more than 1 lakh cases. But let us see the prediction. By 2020, it may cross 1.25 lakhs. So we can say that 1.15 lakh urban women will be diagnosed with a carcinoma of the breast every year. But this is statistics for the cities. 1 out of every 20 women in metropolitan cities can be affected. "50,000 women die every year." It means 6 females die every year. More facts of breast cancer. 1 in 20 to 22 women will get breast cancer in India, whereas the statistics in the United States shows that the incidence is quite high. It is 1 in 8. Of this, 5 to 10% of women have a genetic predisposition. That means they may carry the mutated gene at the time of birth from the parents. If you can detect early and if you can give the right treatment at the right time, the survival rate is, or the cure rate is very high. It is around 98%. And let us see what are the risk factors involved in breast cancer. Who is at risk? Age is a factor for breast cancer development. The incidence of breast cancer increases with age of the women. There is a steep rise in incidence from the age of 35 to 50. And also the women who start menstruating early in life, it's less than 10 years, and women who have a late menopause, say after 50 or 52, also have an increased risk of breast cancer. And the incidence of breast cancer is high. In those women who eat a high fat diet and a low fiber diet. And also the young women taking contraceptive pills with a high level of estrogen for more than 8 years may have an increased risk of development of breast cancer. And also we should remember the importance of family history of breast cancer. What does it mean? Having a relative with breast cancer puts you at a higher risk. A relative means mother, sister, daughter, maternal or paternal aunt or grandmother. So one should know about this type of problems which is being occurred in our family. Always in India, women keep it as a secret. They may not discuss with other family members. So family history is also very important as far as the risk for breast cancer is concerned. Similarly, those women who do not conceive or cannot conceive on late age at first pregnancy increase the risk. Having your first child after 30 years put you at a slightly higher risk. But then, if somebody has got this one risk, or it doesn't mean that that person will get breast cancer. When 3 or 4 risk factors work in a person, there is a higher risk. There is a higher risk. Doesn't mean that one should get breast cancer. Also, I would like to remind you about the importance of exercise. Lack of physical exercise is also a contributing factor for breast cancer. Having said the risk factors, one should know about the clinical features of breast cancer. Usually, early breast cancer does not cause any symptom. In fact, when breast cancer first develops, there will not be no symptom at all. But as the cancer grows, it can cause changes that women should watch for. Let us see those symptoms. The most important symptom, or can say the common presentation, will be a lump, thickening in the breast. See, it's the thickening in the left breast of the patient. Also, one should watch whether there is any change in the shape and size of the breast. Let us see the left breast of this female. This is a normal breast. The shape is changed. In fact, the breast has been pulled up in this. That is mainly because it's a tumor inside. It is pulling the tissue inside. Redness of the skin or small ulceration is also one of the manifestations of breast cancer. You can see that. And the dimpled skin, you can see this. Because the tumor inside the breast is pulling that part of the skin inwards. That is why it produces dimple. See the nipple, it's inverted, pulled in. I mentioned about the ducts, which carry the milk to the nipple. So when the tumor infiltrates the surrounding area, the nipple will be pulled in. So changes in the nipple, whether it is being pulled inverted or changes in the skin like dimpling of the skin or changes like this type of inflammatory reactions also should be watched for. And also discoloration of the skin is also important. You can see there is a discoloration of the skin. That also should be noted. And also one should watch whether there is any discharge. You can see the nipple discharge. If it is maybe blood stained, maybe colorless also. But those type of changes may give some signals to the person. So that also should be watched for. And also breast may be normal. Breast is normal, but see the armpit, there is a swelling in the armpit. So that type of swelling in the armpit may be one of the manifestations of a hidden lump in the breast. So all these changes one should watch for. Some pictures again, ulceration and also the pulling up of the nipple, and even the pulling up of the breast also is visible. This is a normal breast. You can see again the breast is pulled up. Again the nipple is also pulled up. And this is a post biopsy pic. So how will we screen, how will we diagnose breast tumors? The simplest form of screening or examination is self-breast examination. It is very simple, no cost. It's 100% privacy is there. One should check the breast monthly, once in a month, and should feel for any lump or any changes. It is better to start at the age of 25. Let us see how SBE or self-breast examination can be conducted. You can examine your breast in the shower, or you can examine your breast in the mirror. Hold your arms first down, then up, and on your hips, and see, watch for the position of the breast, position of the nipple, whether there is an inversion or not, and see the skin changes and any swelling in the armpit. And then the next step is, the first one is called inspection. The next one is palpation, that is touching with the finger. Always you should touch the breast with the inner side of the finger. The picture shows that. And do it in a circular fashion from periphery to the nipple. And divide breast into 4 quarters. 4 sectors are. You imagine breast as a clock. 12 to 3, 3 to 6, 6 to 9, 9 to 10. Then start from the periphery to the nipple. Gentle circular movements with the inner side of the finger, not with the inner side of the palm. Then lie down and you can repeat all these steps. And also you must squeeze your nipple to check for any discharge. Squeeze and see whether there is any. And also touch the armpit with your finger and see whether there is any lump. So these are simple steps which you can do. But maybe in the first 1 or 2 sessions it may be difficult for you. But then over a period of time you will become an expert in examining your breast. The ideal time to do the self-breast examination is 1 week after the periods. So that time breast will be soft, there will not be any thickening, it will be easy to assess your breast next. This is to be repeated in every month. So, suppose the menopause is achieved or hysterectomy has been done, so you cannot correlate with the periods. And that, for those women, the best thing is to do it on a particular day in a month. Say, first of this month, then every month. Next is the clinical breast examination. We call it as CBE. Here, the doctor examines the patient's breast. And also a well-trained nurse also can do this job. Again, no need of any equipment. We use the hand to examine the breast. You can start by 30 years. Every 6 months will be better. So with that, the doctor can or the examiner can find out breast lumps up to even around 0.5 centimeter, 1 centimeter. And this is the most important investigation. Mammography. In mammography, a soft X-ray is being passed through the breast. You can see the picture also. The breast is pressed between two plates, then X-ray is taken. This is a very sophisticated investigation by which we can detect tumor which doesn't produce any symptom. So that very early detection is possible with mammography. Ideally, one should start at the age of 40 years. It has been recommended to do once every 1 to 2 years. Every year for those who have got a high risk. I already mentioned about the risk factors. So those who have got risk factors, they may be done mammogram every month. After 50, it is better to do again every year. But those who do not have the risk factor, from 40 to 50, every 2 years will be. And those who have got a family history of breast cancer, got a slightly higher risk, they should also undergo evaluation before 40 years. But need not be mammogram always. It depends on the size of the breast or the age of the patient, etc. This is mammogram. This is a picture which we get after passing the X-ray through the breast. It's a normal one. You can see very normal pattern in this. There's a small change if you look carefully. There's a small change in the pattern around or an oval-shaped image you see. But this is not cancer. This is going to be benign cyst. The third picture, see the third picture, you can see an irregular shadow is there. This is more in favor of a malignant or a cancerous growth. If you zoom that picture, you can see small calcifications or deposit of calcium. That is very diagnostic of cancer. So it is easy for us to detect cancer before it produces any symptom. This is called a USG or ultrasound scan. Everyone is familiar with this term. There are special ultrasonography units to do the US or ultrasound scan of the breast. Here the sound waves are utilized for scanning the breast. It is good for young women below 40. The breast is, in young women, the breast will be dense. So usually we don't advise mammogram for young women. So ideal investigation for young women is ultrasonography. But sometimes we use it as a complementary test in all types of patients with mammogram. That will give us more idea about the nature of the disease. This is called a mammogram, MR mammogram. You might have heard about magnetic resonance, MRI. Here, low energy electromagnetic radiation is used. This is good for all types of people, young or middle age. It's very diagnostic. You can see the picture. This gives better information about the status of the breast. But the main issue is high-end MR units are not available in our country, and it is too expensive for ordinary people. So we cannot call it as a usual screening tool for breast. But those who can afford, if the ideal mammography unit is available, MR unit is available, yeah, this is one of the investigations which we can do. How will you diagnose cancer? Suppose the person has certain the symptoms which we narrated, and if it lasts for weeks or more, then we should always go to the clinician or your family doctor for examination. And also an opinion from the right expert should be taken, either from a surgeon or an oncologist, and then the doctor should advise the necessary investigation. The most important investigation to confirm breast cancer is biopsy. Different types of biopsies are being done to diagnose breast cancer. The simplest one is the needle biopsy. It is called FNS. It stands for fine needle aspiration cytology. Here you see the picture. There's a small lump. A small needle is inserted into this, and the doctor aspirates few cells from the tip of the needle. This will be examined under the microscope, and we will have some idea, we'll get some idea about the nature of the cell present around that tip of the needle. Suppose the report is positive for malignancy or cancer, it is okay. We can go for the next step. Suppose that is negative, it doesn't rule out tumor. So in that situation, or in certain other situation also, the doctor may advise an open biopsy. Open biopsy is done under anesthesia. The lump will be removed, or part of the lump will be removed, and again it will be processed, and the pathologist will give the opinion. So definitely that will give a definite idea or a diagnosis or the nature of the tumor present in the breast. But remember, most of the lumps will be benign, that means non-cancerous. So when doctor suggests biopsy, one should not think that I am going to have breast cancer or something like that. In most of the situation, we will get only a negative report saying that certain benign condition or non-cancer like fibroadenosis, fibroadenoma, such diagnosis will be there. Advantages: one, you can be sure about your disease. Two, you can get rid of that benign tumor. So we not worry about the lump present in the breast. And if that is malignancy, then we should think about the treatment. Part of the treatment, it is staging. There are different stages, like from stage 1 to 4. That depends on the size of the tumor and also the spread or skin involvement, glands in the armpit, status of liver, brain, bone, lungs. Depending on those findings, we stage the disease. When it spreads to distant organ, for example, the brain, bone, lungs, liver, etc., then it will be stage 4. When it is confined to the breast, it is stage 1 or maybe stage 2. In some situation, it may go to the lymph nodes, then depending on the number of nodes and everything, again the stage will be different. So for the treatment, for the best treatment, we should practice the best staging procedures. Without proper staging and assessing the molecular base of the tumor, it is difficult to give the right treatment for breast cancer, because breast cancer is not a single disease, it's a group of disease. Every tumor has its own signature. Its molecular behavior will be different. The biological nature of the tumor will be different. So all these things should be assessed properly. And also remember, breast cancer is a very broad word. It encompasses more than 50 types of tumors. So we usually do very precise staging before taking up the case for treatment. How do we treat breast cancer? Mainly there are 5 modalities. The first one is surgery. Nowadays we don't go for mastectomy or removal of the breast. In early cases, lumpectomy will be enough. But in locally advanced stages, we go for mastectomy also. Then after the proper workup, we'll take up the case for chemotherapy or even for targeted therapy. And then we give radiation to the breast. And also some patients may require hormone therapy for 4 to 5 years. But then without staging, we cannot say that which treatment is ideal for the patient. In India, most of the patients need an integration of various types of modalities, like we have to integrate chemotherapy, targeted therapy, radiation, hormone therapy, because 70% of our women report with either stage 3 or stage 4 malignancy. Only 10 or 15% of patients come with a very early stage disease, stage 1. In that situation, the patient may require only lumpectomy or the removal of the lump. Plus, we may give a little bit radiation to that particular breast, but sometimes very early we give chemotherapy. So, everything depends on the stage of the disease. Already mentioned about different types of surgery. Here in complete removal of the breast is done, especially when the size of the tumor is big. There are different factors. I don't want to get into all the details. That is the oncologist will decide in discussion with the patient. And also we go for nowadays we usually do only this, the lump. That is called the BCS or breast conservation surgery. These are some pictures of some of my patients whom I treated a long time back. You can see a small scar here. She reported with a 2 centimeter lump. We removed only the lump and also we cleared her armpit and we gave her some radiation. She's doing well. Similarly, this patient, you can see again a scar here. It's removed. She was given some local treatment with radiation. She's doing well. See this patient, you can see a curved scar around the areola. Small, just very small lump, also 1.5 centimeter in size. When we didn't give any radiation, she's on follow-up. All the 3 patients have completed 10 years now. So, excellent result. So, that's the advantage of early stage tumors. Now, the big question is whether it can come back. People are also worried about this. Yeah, there is a slight risk for relapse because even a 1 centimeter tumor made up of contain billions of cells. So, if we leave one cell, maybe after some point of time it can come back. And it can even spread to other parts of the body. And these cells can multiply there and can result in recurrence. But when we give the right treatment, the chances for recurrence will come down drastically. That is why we give radiation to the tumor bed and some situation chemotherapy, and also in some situation we give hormonal treatment because these tumors have receptors on their tumor. Receptors means the special site for estrogen to act. You might have heard about female hormones like estrogen and progesterone. So most of the tumors depend on these hormones. So we can identify which tumor has these receptors. If the tumor is positive for estrogen progesterone receptors, we can put the patient on some tablet so that will encounter the estrogen action. It will neutralize the action and the results will be better. So in some situation we'll give hormonal treatment also. What's the risk of cancer coming back? Again, depends the type of the cancer. I told you 2 different types are stage of the disease, incomplete or improper treatment. So if those things are there, then there's a chance for relapse. So the most important thing is a regular follow-up. But this is not very common, or people do not follow this in this part of the continent, especially the villages and other places. Regular checkup is very important to find out recurrence. We can again find out recurrence at a very early stage. Usually yearly we do mammography, ultrasonography, and once in 2 to 3 months we do physical examination. So regular follow-up is very, very important. Whether we can we prevent breast cancer? The answer will be no. We cannot prevent breast cancer, but definitely we can reduce the risk for breast cancer. Prevention is like once you immunize, once you get vaccine for polio, you prevent it. Like that, you cannot prevent breast cancer. But if you follow a good diet, especially incorporating soya at an early age, and also including pesticide-free foods and vegetables, and high fiber containing food in our diet, definitely it will have a positive effect on the breast. And also regular exercise. We should do exercise 5 days in a week. Every day, 45 minutes to 1 hour. Brisk walking will be enough. And also one should keep very healthy body weight. and also no smoking, no alcohol. Also try to, for the first baby before 30 years, also should remember breastfeeding also reduce the risk of breast cancer. And there are other methods too. One is called mastectomy. People does prophylactic mastectomy, preventive removal of the breast. Those who carry the genes for breast cancer, you can think about prophylactic mastectomy and reconstruction of the breast. But that is reserved only for women at high risk. And there are certain tablets also for the chemo prevention that also will lower the breast cancer risk. Always remember there are myths associated with breast cancer. Men do not get breast cancer. That's not true. Men also may get breast cancer, but the incidence is very low. And another myth is there is a lump. People always think that it's breast cancer. It's not right. 90% of the lump may be benign, maybe 10% may be valid. So, feeling a lump or a change in the breast, yeah, one need not worry about that. One should not be scared. One should not run away. One should go scientifically for and get rid of the lump. Mammogram are harmful. Yeah, if we do it the right time for the right patient, right people, it's not harmful. Of course, it is a soft X-ray. So that is why we avoid mammogram for young females. We go for ultrasonography or magnetic resonance imaging. Another big question is, very often people ask, Doctor, is it contagious? No, it is not contagious. Never ever see that. So you can be very free with the person who is afflicted with breast cancer. One should always, one should not keep away from breast cancer patients, never ever contagious. Usually people ask these questions also. Antiperspirants, deodorants, whether it produce cancer? No. So far no evidence. And what about the size? Big breast means there is a risk? No. There is no study which demonstrate or which link size of the breast with breast cancer. And also a positive gene test, will it link to cancer in all cases? No. There are genes called BRCA1, BRCA2. These genes associated with the breast cancer, but this mean that the person will definitely get breast cancer. Too young to get a breast cancer. Yeah. No age is immune. Even a 17-year-old girl can develop breast cancer. 100-year-old female can get breast cancer. So there is no immunity. Is breast cancer a death sentence? Not at all. Never ever think like that. Breast cancer is curable. It's treatable. It is not a death sentence at all. But only remember, early detection, right treatment at the right time is the most important thing. And usually people ask in the outpatient department, always is in the form of a lump? No, need not be. But usually the presentation is like lump, but sometimes, as I've already shown you the photographs, there can be pulling of the breast, nipple may be pulled in, changes in the skin, and even a small lump in the armpit. So, need not be always with a lump. So, we should think about all other clinical or the signs and symptoms of breast cancer. Father's family history of breast cancer doesn't affect the risk as no. Even father's family history is also important because We carry gene from the father as well as the mother. So any vertical, any transmission from the parents can lead to a higher risk for breast cancer. So what is the carry home message? Prevention and early detection are the best means of conquering the disease, so that cancer doesn't stand in the way of your dreams. Early detection is the most important thing. You know these two females, our own Gautami, Kamala Hassan's friend, and also Angelina Jolie was very much in media the last 3 years. What she did? She loves her children. Everyone loves children, but Angelina Jolie has got a special plan. She lost her mother. She lost her grandmother due to breast cancer. So this intelligent lady did her gene profile. She found breast cancer carrying gene in her blood. BRCA, breast, B for breast, BR for breast, C for cancer, breast cancer. Gene 1 and 2. She had a very high risk of developing breast cancer and ovarian cancer. The risk was more than 80 to 85%. So she took a decision, with the consent of her boyfriend, to undergo prophylactic or preventive mastectomy. You might have read about in the newspaper. It had created ripples across the globe. An actress, that being the Hollywood, how come can undergo mastectomy? But she took a very bold decision, very scientific decision, very intelligent decision. She loves her life, she loves her children. So she underwent mastectomy, and of late she underwent oophorectomy, that means removal of the ovaries, because these two genes, if one carries, there is a very high risk for ovarian cancer too. So that is why she did 2 surgeries, and she underwent breast transplantation also, and also she started her acting career. Okay, thank you very much for the question sharing. If you have any questions, please.
Yeah, participants, if you have any questions, you can type it out in the tab which shows questions. You can just click on the tab so that you can type out your questions, and the doctor would answer the questions as when you ask the questions. No questions?
It means that everyone has understood it clearly.
Yeah. So I think if there are no more questions, then we'll wind up and we'll share. your email ID or something?
Yeah, no problem. CNML.
Yeah. So, if you have any questions, you can write to doctor also, or probably you can share it with CI office, and we will forward it to doctor. So, I'll send you a mail with details to which you can email it to us, so that we will share it with the doctor, so that you can get your queries cleared, and it will be easy for you to get it directly from the doctor. So, we'll help you out in that way. Yeah. So, thank you, doctor. Thank you so much.
Okay, thank you very much.
Thank you.
How did it go?